I'm Dr. Connie with Wellness by Design, and if you're watching this, it's likely because you are a man who may suspect that you're suffering from low hormones. So what might those symptoms be of low hormones? Well, first of all, you may have fatigue, you may have low libido, you may have difficulty building muscle even though you're working out. You may come home after dinner and fall asleep in the chair. So if you suspect any of these, what you're going to want to do is to come in and get your hormone levels checked, because that is the only way we can determine as to whether your levels are low or not. So once your levels are checked, we're going to have someone here evaluate them, and then based on that evaluation, make a recommendation for you to come in and talk further about it. Now, a lot of men have concerns about whether hormone replacement therapy is safe. So what we recommend, in fact, we have several copies of this in the office. We recommend that you read this book, written by a Harvard-trained urologist, Dr. Morgan Taylor, and he will answer all of your questions. He even has a complete chapter talking about prostate cancer, because that's what men are most concerned about. So it turns out that prostate cancer is not caused by having high levels of testosterone. And he makes that abundantly clear. So again, if you have any concerns about the safety of hormone replacement therapy, then you will want to get this book. Moving on. So let's just assume we find out that your levels are low. So moving along, you're going to want to get this book. But I'm going to give you some brief educational points right now. So what are the levels at which a man would want to get their testosterone increased? A lot of doctors are not educated on this point. They'll tell you that your levels are normal when in fact they may be average for your age, but that does not mean they are optimal. What we know is that men start feeling the symptoms of low testosterone if it drops below 600. So our goal for men is to keep the testosterone level in that sweet zone, somewhere between 850 and 1200. That's when men feel their best. So what are the options for hormone replacement therapy? I'll start with the least effective, which is topical. So you've probably seen ads on TV for androgel. There are various other formulations or brands, but basically this involves putting a topical substance on your skin. The problem with this method are several fold. Number one, it can be absorbed erratically or not very well at all. Number two, it can transfer to family members, including spouse, children, even pets. Think of the ramifications of having testosterone on those family members. But really the thing that really affects your decision is that topicals just don't work very well. So we have a lot of men coming in complaining about that fact. So then we present them with our other options. The second option is injections, which you have to administer to yourself at home, unless you can get your spouse to do it for you. The problem with injections is that the levels can go up and down, and they can go too high, then they can dip too low over the course of even a week. So it's harder to stay in that therapeutic zone. Also, the injections are somewhat painful, and so men get tired of that method fairly quickly. The option that we like the best are pellets. So what are pellets? Pellets are a concentrated, pure, bioidentical testosterone compressed into a pellet. This is an actual pellet encased in its sterile wrapper, so we would not, of course, open this until it's ready to be inserted. So pellets are inserted in the upper outer quadrant of the buttocks, right here. Everyone has a nice little fat pad. And so we numb the person up first, so the procedure is painless. It takes about 7 minutes, and we're going to put in a few. The exact number is determined by your unique body type and levels and symptoms. So we create a customized prescription, and we send that prescription to a compounding pharmacy. They're going to mail it to you because it's customized for you, and then when you get it, you bring it into your first appointment for pellets. Once those pellets are in, typically it's about 2 or 3 weeks before you start feeling much better. So if you've had achiness or fatigue or low libido, or you can't gain muscle, or you can't get rid of belly fat, hopefully those symptoms will start to resolve. And in fact, with pellets, we can guarantee a therapeutic blood level. So I hope this has answered some of the questions that you may have about testosterone replacement therapy. And we look forward to seeing you in the office and hopefully can start working with you to resolve this issue for you. This is Dr. Connie with Wellness by Design.